audience. Let me share my progress on my PhD topic, metabolic changes in pancreatic disorders. I'm Mónika Lipp, a PhD student and a gastroenterology resident at Semmelweis University. My personal vision is to take action on quality of care. Here you can see our ongoing projects. We are investigating the effect of the fatty pancreas and how can increases the risk of pancreatic cancer by conducting a meta-analysis. In our second plan, we try to understand the connection between the metabolic changes and the pancreatic disease progression through a register analysis. So, in our first project, we try to understand the connection between the fatty pancreas and the pancreatic cancer. It is known that pancreatic cancer takes the first place among asymptomatic cancer. Moreover, it is among the leading causes of cancer mortality in developed countries. And only 4% of the patients will live 5 years after the diagnosis. It is shown that pre-existing metabolic changes can contribute to the development of pancreatic cancer. It is also shown that there is a link between fatty pancreas and pancreatic carcinoma. Fatty pancreas described as a fat infiltration of the pancreas, mostly presented in obese patients, but overall it's shown in 35% of the population. Our aim was to detect the association between these two entities. So, we would like to investigate if fatty pancreas predisposes to the development of pancreatic cancer or not. We will include patients where the fatty pancreas and the pancreatic cancer was described. Our main interest of outcome will be the prevalence or the ratio of fatty pancreas, with the hypothesis that fatty pancreas increases the risk for pancreatic cancer. After our systematic search in 3 databases with this final search key you can see below, we ended up with 17 eligible articles for our meta-analysis. Here, we investigated the presence of pancreatic cancer among patients with fatty pancreas. Early detection is highly important because patients mostly present at the late stage of the diagnosis. And there is a forecast that pancreatic cancer will be the leading cause of cancer mortality worldwide by 2015. So, we investigated that how many fatty pancreatic patients had pancreatic cancer in the case and in the control group. We used odds ratio with 95% confidence interval. We included prospective and retrospective, cross-sectional and case control studies. The odds of having pancreatic cancer among patients with fatty pancreas was 32% higher compared to the control group. It's clinically relevant, but not surprisingly, it's mathematically not significant because fatty pancreas later can progrediate to pancreatic cancer. That's why we changed over the question to see the real connection. So, how many pancreatic cancer patients had fatty pancreas? It's not just only 32%. The probability was more than 6 times higher compared to the control group. It is clinically and mathematically significant, so the connection is there. The clinical implication would be that the measurement of the fatty pancreas should be included in the routine radiological examination, and further prospective observational studies should be carried out in this topic. Here we investigated the proportion of fatty pancreas among pancreatic cancer patients. The heterogeneity was quite high because sometimes they included patients who underwent EUS for various kind of hepatobiliary indications, and in the other case they included patients who had pancreatectoduodenectomy for pancreatic cancer. So the proportion was 62%, which means that it more than half of the patients with pancreatic cancer, fatty pancreas is also presented. So, our strengths were that we were able to strengthen the connection between fatty pancreas and pancreatic cancer. We included 17 eligible articles with more than 3,000 patients, and it was the first meta-analysis conducted with a strict methodology. However, we had to deal with the heterogeneous patient population and the most retrospective nature of the studies. In conclusion, fatty pancreas predisposes to the development of pancreatic cancer, and I would like to highlight that the probability of having fatty pancreas among patients with pancreatic cancer was more than 6 times higher compared to the control group. The implication for practice could be that the description of fatty pancreas should be well described because there are so many different definitions of that. And the implication for research would be there should be more prospective observational studies in this topic. So here you can see our ongoing progress. We are ready with the grade assessment and we are working on the manuscript. In our second project, we try to understand the connection between the metabolic changes and the pancreatic disease progression. Metabolic syndrome has a key role in the development of acute pancreatitis. It is shown that hyperlipidemia and diabetes contribute to the development of acute pancreatitis. GULASH Plus is an observational longitudinal multicenter investigation of acute pancreatitic patient, and it gives us an extremely well-characterized patient population to be followed up. So, on admission and in hospital, glucose levels are independently and dose-dependently associated with AP severity and mortality. On the right side of the slide, you can see that BMI above 25 increases the risk of severe acute pancreatitis, while BMI above 30 increases the risk of mortality. Our aim is to understand the different parts of the metabolic syndrome and how they contribute to the development of pancreatic diseases. So our clinical question is that what are these factors that can contribute to the development of these diseases? We will include patients from the GULASH trial, and our main interest of outcome would be the ratio of newly developed pancreatic diseases. The clinical implication would be the prevention and the early detection of these diseases. So we are at the data retrieval part. We uploaded the system or plan. We had a meeting with the team, and the quality check is ready now. As a summary, I would like to highlight that we are working on a meta-analysis which has proven that the probability of having fatty pancreas among patients in pancreatic cancer population was more than 6 times higher than in the control group. In our second project, we try to understand the connection between metabolic changes and the pancreatic disease progression. Well done is better than well said, by Benjamin Franklin. Thank you for your attention.
Why is it so difficult to define the fatty pancreas?
Yeah, thanks for your question. So sometimes they define fatty pancreas as non-alcoholic fatty pancreas. And sometimes they just write ectopic fat accumulation in the pancreas. So there are different kind of definition, and we can measure the pancreas with, for example, CT and EUS as well. And there are not well described cutoff values for that measurement. And also the gold standard is the histology, which can be done mostly from autopsy. So it's really hard, and there isn't a clear definition for it.
Does the obesity come with fatty pancreas?
Yes, yeah. I also mentioned at the beginning that fatty pancreas mostly presented in obese patients, and there is a meta-analysis which targeting these two entities, fatty pancreas and the obesity, and so you will find, it's not a surprise that you will find more fatty pancreatic patients in the obese group.
And can we tell you that the obesity patients are a high-risk group about the pancreatic cancer?
So overall, obesity patients are at the high risk of so many kind of cancers, and I can see that maybe yes, but there aren't like a strict evidence behind it because there aren't enough studies, as I know.
Your outcome was that we should basically screen these patients for our record if the patients have an pancreatic steatosis. What modality would you recommend as the most reliable one?
Modality, yes.
Yes, or most practical one.
Yes. So mostly EUS and CT could be the main two modalities. In our included studies, they mostly used EUS, so I recommend that examination. And for example, we excluded like just the abdominal ultrasound patients because it doesn't give us the right amount of information of the pancreas when just the abdominal ultrasound was done. Because, for example, when you think about on fatty liver, like abdominal ultrasound can detect it like in a really good form. But for fatty pancreas, it's not always easy to visualize with the abdominal ultrasound. So that's why more like invasive these screening methods needed.
You talked about a systematic review on obesity and the risk of pancreatic cancer. I would like to know if they used BMI as a marker of obesity or if it was another method for description of obesity. And if it was a BMI, is there any plan on analyzing the body composition on the occurrence of this kind of cancer?
Yeah, so regarding to your first part of the question, yes, like BMI was the standard measurement, but they also like measured the different. So they had like a subgroup about like fatty parts of the body. So they somehow compared it as well, and we also wanted to do like subgroups, but we haven't had enough data from these articles to do a subgroup based on BMI, but we were planned to do it.